A huge announcement. Montana's been awarded $233 million for rural health care, with a possibility of seeing $1 billion over the next 5 years. Leaders in the state's healthcare networks, like Riverstone Health CEO John Forte, say they're surprised how fast the process went from the program's announcement to the recent federal approval of the state's plan.
From our submission to the state submission to the feds, and then federal approval and disbursement of the funds. I think it was one of the fastest things I've seen happen from a federal or state level.
And it couldn't come soon enough. Rural healthcare in Montana and across the nation is in a crisis.
When you're taking care of folks that have maybe delayed care or are just used to sticking it out on their own, the care that they end up needing in our rural communities is much greater. So more resources, more financial burden, more pharmaceutical intervention, etc.
Jim Duncan understands that need. He's a project lead for the Rural Healthcare Transformation Program, representing a handful of hospitals across the state. He worked with the state on applying for the federal money and understands that $233 million could be a game changer for rural Montana.
I think there could be new ways to look at programs that might be able to be delivered differently in those communities. They might want to reassess all of their offerings and look at how new offerings might be a better solution for a community.
For Forte, a big push will be getting a solid workforce where they're needed.
We're hopeful that this funding will go to expand our residency programs, expand our rural residency, which will be starting out in Miles City.
And then giving that workforce the necessary technology, from MRI machines to accessing patient records,
is going to help bridge the gap between electronic medical records that don't necessarily talk to one another.
Duncan says it will be important for the state to spend the money with longevity in mind, as such an opportunity is not a frequent occurrence.
Our focus is on getting as many of these dollars that are available to the front door of where rural health care is delivered.
In Billings, Will Wagner, MTN News.